The COVID-19 vaccine has been dominating headlines in recent weeks, but in the meantime, health officials say other vaccination rates in Wisconsin have been dropping, including the HPV vaccine, which health officials say can prevent several types of cancer. Newswatch 12's Megan Mamlock joins us now live in the studio with more on this story. Megan.
Thanks, Justin. January is Cervical Cancer Awareness Month, and health officials would like to remind parents to get their children, both girls and boys, the HPV vaccination, which will protect them as future adults.
We are noticing more of these head and neck cancers related to HPV, so that's a trend that's rising. And then we're seeing that although Wisconsin has been improving our HPV vaccine over time, we are lagging behind some parts of the country, and we have a long way to go.
Health officials have noticed a decline in vaccinations because of the pandemic, as less people are going to their doctor appointments, resulting in less children getting their cancer prevention HPV vaccine.
And head and neck cancer, which really affects men much more than women. This oropharyngeal type is the predominant type, is all HPV related. And I'm sure people have seen the commercials with the person that's had like the big surgery, or they have the tracheostomy. That's the kind of stuff we're talking about preventing with HPV vaccine.
HPV can be contracted through oral and traditional intercourse.
It only takes one sexual partner to get HPV. This is certainly not, something that you have to have lots of sexual partners to get infected with. Most adult Americans have been infected with HPV. It's just some people happen to get the strains that are linked to cancer. It's not all types of HPV that cause cancer.
Kids are able to get the 2 doses of the vaccination 6 months apart as early as age 9, typically 11 to 14-year-olds. Getting the vaccination will prevent cervical, anal, vulvar, vaginal, penile, and oropharyngeal, which are difficult cancers to treat.
These are really tough cancers to treat. And I think that's part of the problem, is that they're cancers that adults get. And so it's hard for a pediatrician who treats children to talk to the parents and the child about what they're preventing, because most of the time these doctors haven't seen these cancers.
Children are able to receive the HPV vaccine at their primary care facilities, protecting them in the future from 6 types of cancers and other potential chronic morbidities.